Okay, well, welcome everybody. I'm really, again, happy to be back. I didn't look at who's on today, but I know many of you have been on in the past weeks and with our other ARC team members, and I really appreciate you coming back and staying connected. I put this very happy picture of our ARC team clearly having no idea about social distancing right before this pandemic hit, but it just made me happy, so I wanted to share it. And there's a real need for sharing happy pictures right now. And I don't want to go over the ARC again because I know you all know just what we do as an organization, but I did want to remind everybody that we are the voice of families on Beacon Hill, and with EOHHS and on policy issues with Mass Health. So our need is to really stay connected to you and hear your voices so we can be that leadership role on Beacon Hill, and also to really report up to our national organizations so that we're all working together to make the change happen. So I just wanted to remind you of that. And again, if you are not joining our other webinars, take a look at our website under the COVID tab, and you'll see the weekly updates from Leo and Carrie and Ellen. And I think Ellen has a guest this week, tomorrow, from the ARC US. So that would be really worthwhile to tune into. Okay, so I just wanted to go over the goals for today, and I'm maybe making this a little bit shorter. We are in the state surge, so we're going to go over a little bit of what's happening and kind of where the fires need to be put out. We'll talk, I really want to give you a review of the Mass standards of care because a lot has happened this week, actually yesterday, and I'll bring you up to speed on that. I also want to talk about something that also just came up yesterday, which is hazard pay for direct support professionals. And this is something I'm going to ask everybody to take action on as well. I'll quickly go over our ARC survey again, this time looking at the non-English speaking responses and asking again for your help to get people to connect to us when they're in trouble. We'll go over a little bit about what's happening in the Mass legislature because they're busy. And again, I'll review all any way that you guys can help take action. Okay, so that's a lot. And Carrie, you will interrupt me if someone has an urgent question, right?
Yes.
Okay. All right. Well, I also wanted to start by keeping it real again, just to give you a little case study of my own family. I know many of you out there have your family members home and are dealing with a lot of challenging behavior and just challenges in general. Grocery deliveries and just worrying about finances, behaviors and illness, all these things. And I wanted to share this picture. The one at the top there of Neil with the food all around him may look a little bit ridiculous, but this is a real serious problem for me and for my family. Neil has something called food hoarding, or I like to call it food bullying. And this was my basically failed attempt at keeping all that food away from him. But his anxiety is very high, and it seems to soothe him to have food all around him. And honestly, when the food is denied, or there's even a perceived denial of food, that is when we get aggression and self-injury. So trying to balance that. And we had a bad day yesterday with some self-injury around perceived denied food access. So lots of struggles for him. We're also trying to get out, but like most of you probably have, it's hard to even find a place to walk that's not crowded at this point when it's when the weather is nice. And again, keeping PPE on. Tyler's doing a good job there, but Neil just won't do that. So So I get what everybody's going through. Everyone's going through something different, but I thought I'd keep sharing a little bit of how we're getting along. Okay, and on to some really tough news. Like I said, we are in the surge. Many of you have seen these numbers. We're totaling over 29,000 cases as of yesterday, close to 1,000 deaths. And again, the long-term facilities are taking, the deaths in the long-term care facilities are a good chunk, almost 40%. And yesterday they did come out with a town-by-town analysis. And I just put down a couple of the towns that seem to have the higher numbers. Williamstown higher, but per population. So we think that we're in this surge until the 20th, or maybe a little bit longer than that. So everybody just stay safe. Okay, so I'm gonna go over some of the community's concerns, and the first one, hazard pay for state employees. This is a good thing, you would think. Yes, it is. That came out yesterday from the Secretary Sutters and the governor. But the problem is that hazard pay was given to state employees that work in state-operated facilities and not across the board for our community-based providers. And so we need to, our voices heard on this. That obviously an equity issue is huge. We want to make sure that that the amazing direct workforce is getting paid. Some of them are quarantining 24/7 for 2 weeks because they've been exposed, and others are working 12-hour shifts to ensure that there's not too much turnover and too many people coming into the group homes. And others are running around to families and delivering groceries and doing all kinds of things. So we really need to make sure, because they are essential employees, that they are getting hazard pay across the board. So the fact that other areas of the sector got increased pay, $5 to $10 more per hour, and also that along with overtime can actually bring an individual's pay up to, potentially up to $30 per hour, where the folks in the community-based programs are still probably struggling, even with increases, to get to 16, 17 an hour for the same work. So what we're pretty sure we're going to see is an exodus to get those better paying jobs. And if you can imagine the crisis that will, it'll be catastrophic, really, to have our community based homes lose staff at this point in time. For our individuals, it would be a real nightmare. They're already experiencing this isolation and confusion around what's happening, and then to lose staff. Maybe I will chat in the link, but if you go to our Facebook page or my Facebook page or the ARC's website, you will see our Take Action is up. Actually, go to Take Action as your first choice, and you'll see the letter that is to go out to your senator and rep, and it asks them to please be in touch with the governor and the secretary on this issue. And this is just one of those ones we got to get out quickly. Okay, so good news is that mobile testing has arrived to our group homes, and that started on Monday. And I think I heard that all of that's going pretty well. So if someone is showing symptoms or has had a positive test, the mobile testing units are getting out quickly to the group homes to test everyone. So hopefully that will help us get on top of how we need to isolate and quarantine. Again, I think I mentioned this last week, but the recommendations are really to have health forms ready to go and filled out. There's definitely been some great information out there about having forms from your primary care doctor that talk about the needs of the individual with the disabilities, and then maybe another form that speaks to your role as a caregiver and why that's necessary. But take a look at our website. We have a link to forms around healthcare, and I know group are beginning to do this as well. So staff and agencies continue to evolve as guidance changes, and again, as staff decreases based on illness and quarantine and testing positive. So we are definitely in a worried state for those individuals that are in our group homes and our community settings, even those who are isolating themselves, who are living either independently or semi-independently. And we know PPE is still a problem, especially gowns. It's so much more than just masks because of the contamination when someone is coughing. And so even if masks have arrived, goggles, gowns, gloves, all of that is still needed. Okay, so I'd love to just give you a quick overview of what's happening with the mass crisis standards of care. If you were on the call last week or been following this, the guidance came out from our state after a couple of weeks of us anticipating this, and many agencies had written into EOHHS and the governor and the attorney general and the Mass Hospital Association to say, to warn them that we wanted to make sure this policy that came out was not discriminatory. The guidance did come out last week, and Massachusetts advocacy organizations do feel that there is discrimination against people with disabilities and other at-risk groups. So there's been a really amazing, fast working group of lawyers and other advocacy leaders to come up with a letter that is based on the Office of Civil Rights guidance that came out as well, and also on other states that have responded to their own states' guidance around triage of care and healthcare rationing. So that guidance came out. The response of the community is, that we really need to move on this. So we have a complaint ready to go as of yesterday. But also yesterday we heard a response from Secretary Sutters, which was great to hear. She did say that the committee that had originally put together this guidance, this mass crisis standards of care, was reconvened, and that they were working on meaningful changes to the guidance. So given that, the group decided to hold off on filing the OCR complaint, the Office of Civil Rights complaint, and waiting to hear until tomorrow what our committee has come back with in terms of new guidance. That said, we did send our recommendations directly to the secretary and others so that this committee will know in detail what we think needs to happen on that guidance. And just to give you, yeah, I hear you.
Oh, hey, so Beth has a question about how is it discriminatory towards people with disabilities?
Good, okay, here we go. So I'd say the main issue is that we need explicit insurance that all individuals, regardless of their diagnosis, have access to life-saving care and regardless of their functional ability or ADL needs. We need that explicitly written into the guidelines. We do not want an individual penalized by a chronic, underlying, but stable condition. So obviously, many of our folks have underlying conditions, and we actually need to make sure that any comorbidity or long-term prognosis does not add points to their score in terms of triage. So it's a very complex process, but individuals are scored, and it's called a SOFA score, SOFA. And when you have underlying conditions or other functional impairments, or they're looking at long-term prognosis based on a disability or an underlying condition, they add points. And And this is a really discriminatory way, especially when it's not based on objective medical evidence. So these are sort of the 6 areas that we're focused on in our OCR complaint. And I would say that things are changing kind of daily. So I'm not sure if we're 100% on point with the language here, but mostly the issue is to make sure there's explicit assurance that triage decisions do not result from anything other than objective medical evidence. And then our last point was really to require the standards to include reasonable accommodations for people with disabilities. And that touches on, as I mentioned last week, the need for an individual to have support during triage and during care in an emergency room or in an inpatient setting. So those are, does that answer your question, Beth? All right, well, we'll keep going. This I wanted to put in because if you were with me last week, I had the word cloud up for our survey that came in that pretty much wrapped up about 300 folks, but they were pretty much all English speaking individuals. So this is a very different word cloud that looks at basically Chinese and only a few Spanish speaking families. But last week it was all about behaviors and the challenging at home lack of structure. But here what's really showing is food, fear, money, and no information. And when we look a little bit deeper into the analysis of the survey, no information is really concernable, and obviously food and money and joblessness and all of these concerns. So my ask to any of you are, if you know of someone who does not feel like they're getting enough information about what's happening or resources, to please direct them to the ARC, and that, you know, we're working on all of these issues with our legislature, with our administration. We also want to mention that even though we are pushing everyone to go to their family support centers, but there's also community-based help too. So we need to make sure everyone is reaching out to every possible resource. And yeah, so and contact me if anybody feels like they have a way to get more information out to families.
Thanks, Maura. Lucy had a question again about the standards of care.
Oh.
She's wondering, is there still a shortage of ventilators that requires use of the standards that are being requested?
So as far as I know, there has not been any need to implement any rationing so far. This is all in preparation for that. And we do know the surge is coming, and they have built out the medical field hospitals to prepare. So far so good that we haven't needed to ration any ventilators and ventilator care, but we don't know what's coming. So this is why it's critical. Okay, so just giving you a quick update on what's happening in our legislature. As I said last week, they're all still working really hard. We were so happy to hear this week in front of Children, Families, and Persons with Disabilities was a specific bill to help people who are at risk, and it's a $23 million bill, and we are going to be following up. I said next week, it's today, with Children and Families, not only on this bill, but to bring some other issues directly to them, to have them help us, work with the administration. So it is difficult for the legislators right now because a lot of decisions are being made at an administrative level with the governor and EOHHS, but they can weigh in, and that's why it's so important that we keep in contact with them. And I said this last week, but just keep in contact with your senator and rep around your own situation. Let them know exactly what's happening with your family, or if you work for an organization, keep them abreast of what's happening. They did pass the housing eviction moratorium in the House, and it's in front of the Senate, so hopefully that will move through quickly. And I know Ways and Means is studying the economic impact. So everyone's still pretty busy. They also passed the sexual assault bill last week, and I put that up there because it reminds me about the fact that abuse does increase during crisis situations. So for all of us to just be aware of that. Obviously, we are not able to prioritize things like Nikki's Law at this time. So we have to really be aware of that kind of abuse when people are under stress. So just your, yeah. Go ahead.
Glenn does have a question.
Sure.
What's the link between the CSC and hospital-based policies, which may conflict?
Yep. Yeah, that's a really good question, because the CSC is actually just guidance, but it is based on the office. So any of our crisis of standards of care is guidance, but if they do not follow the guidance, then they are at risk for funding to go away in terms of federal funding if they are discriminating based on the OCR. But these are just guidance, so it doesn't necessarily connect to policies within the hospital. Although when the first CSC came out, hospitals were all very educated on it, and that's another piece of the ARC's advocacy here, is that we are trying to actually get in there and train triage teams. And I know that seems like a really big ask, because these triage teams are obviously incredibly busy. You know, they are the heads of ICU and heads of nursing and things like that. But what we're hoping to do is to literally give them a 5-minute web-based training on implicit bias, so that some of these decisions that might be being made totally, you know, kind of unconsciously, this might trigger, this training might trigger. So yeah, so that's a good question. This is more guidance than it is policy for each and every hospital. But we are also, sorry, there's so much information on the standards of care. We're also reaching out to every single hospital with our letter, kind of pleading with the hospital's emergency room directors and others to take a look at the needs of people with disabilities in a different way. Okay. So yeah, just reviewing kind of what's happening and what we are advocating for, new and ongoing. We need to be treated as essential, basically across the board. Our workforce, our individuals, families, we're all essential. We need more PPE. We need a better safety net. We need to continuously pump money into the safety net. This healthcare and triage rationing issue is a huge priority across the nation and here in Massachusetts. And now the hazard pay equity in our disability workforce, we cannot afford to lose our workforce now. And you know, when this pandemic starts to end, we don't want to be scrambling to even get workforce back in the door. We need more attention to congregate care. We see what's been happening in nursing homes and in some of the VAs, and we do not want to see that happen in our group homes. We have requested to DDS to consider a guidance around crisis planning for families who are home and a caregiver who may get sick, and or multiple family members. And just to remind you that current bills can still be heard. And so it's time, you know, still a good time to push with your legislators. A couple of the bills that had passed through Children and Families and are in either healthcare finance or Ways and Means may actually be heard in the month of May. So it's, we don't want to give up on those. And some of them could be timely and very important right now. So that's a little update, and I'm glad I finished on time today so we can take some more questions.
I know we had a question about how many letters have gone to the governor so far.
Oh yeah, great question.
Last,
So, go ahead, Carrie.
yeah, no, that was the
Yep,
question.
Yep, over 1,000 have gone out. We just put our new ask out this morning around the workforce and around the hazard pay. So we can definitely try to get an update on that. Hopefully, we're sharing it broadly. So, what advocacy efforts?
Okay. Yeah, and then Glenn's wondering about the advocacy efforts to support families who sorry, I'd move that down, who may not have immigration documentation so that they can move more confidently and participate in COVID-19 testing efforts.
Wow, that's a great question. I'm definitely going to have to get back to you on it because I haven't heard much about that, but I'll email you and we'll do that as an update next time, or I'll grab Leo to do it on Monday.
Okay, thank you. And Melissa's wondering, who is the group home working on training the healthcare provider workforce? My research focus is nurses' attitudes and emotions towards caring for people with intellectual disability. I'd love to help with this. That's great.
Melissa, that is great. So right now we're thinking literally it's going to be, if you're talking about the training that we're trying to do to the triage teams, it's going to be literally a 5-minute web page training, but I can send it to you, have you look at it for any comments. Mostly it's probably going to be a quick video because this is like all they're really going to have time for. You know, ongoing, if we end up having more time as this plays out, certainly we can try to do more extensive training. I appreciate that.
Okay, thank you. And just the ARC updated it. We almost have 100 letters out on hazard pay, which is great.
Fantastic. That's great. Wow. Any others, Carrie?
I don't see any others. Anybody else want to chat in a question? All right, and I got Melissa's email address for you, Maura. I will I'll send that off to you.
The only thing else I wanted to add, since I didn't do a specific DDS or Mass Health update, is that we are continuing to, there was guidance that came out from DDS this week, and I think an additional DESE guidance came out this week. So check the website under those categories and you'll see the guidance that came out. But really what's happening is a little more flexibility. I don't know if this has come up in your webinar, Carrie, but just the idea that DDS is reimbursing for mileage for all those times we're driving around. So keep your receipts and remember that there's real flexibility now. And also I did hear that AANE and also Doug Flutie is still trying to support families. So to reach out to either one of those organizations as well. And thank you everybody again for being here, and please stay well this week.
Okay. Thank you, Maura.
Thank you. Take care, everybody.
Thanks.